Thank you so much for joining us tonight for what's going to be a compelling conversation. I'd like to thank our sponsor for tonight, the Horizon Foundation, Howard County's Community Health Foundation. Horizon is committed to improving health through innovative initiatives, collaborative partnerships, strategic grant making, and thoughtful advocacy. Thank you also to the library systems across Maryland who are supporting tonight's event: Anne Arundel County Public Library, Carroll County Public Library, Ruth Enlope Library, Prince George's County Memorial Library System, and Worcester County Library. Before I hand it over to our special guests, I'd like to share some information about Howard County Library System's new racial equity initiative. At Howard County Library System, we believe in standing against racism and hatred each time it is in our midst, and strategizing and enacting change until America's promises ring true for all people. We believe true and lasting change requires true and lasting intention to learn, grow, and act. That is why we launched a new initiative, Brave Voices, Brave Choices. We will add a link to the chat for you to learn more about this new educational initiative, where you will find resources for suggested readings, additional events, and our story collection project. Our special guest this evening is Dr. Camara Phyllis Jones. Dr. Jones is a family physician, epidemiologist, and past president of the American Public Health Association, whose work focuses on naming, measuring, and addressing the impacts of racism on the health and well-being of our nation and the world. Dr. Jones is currently a presidential visiting fellow at the Yale School of Medicine in the Department of Internal Medicine and the Office of Health Equity Research. Will serve as the 2021-2022 presidential chair at the University of California, San Francisco, and was the 2019-2020 Evelyn Green Davis Fellow at the Radcliffe Institute for Advanced Study at Harvard University. She taught 6 years as an assistant professor at the Harvard School of Public Health, served 14 years as a medical officer at the Centers for Disease Control and Prevention, and is currently an adjunct professor at the Rollins School of Public Health at Emory University and an adjunct associate professor at the Morehouse School of Medicine. Dr. Jones's allegories on race and racism illuminate topics that are otherwise difficult for many Americans to understand or discuss. Recognizing that racism saps the strength of the whole society through the waste of human resources, she aims to mobilize and engage all Americans in a sustained national campaign against racism. This event is the first in a two-part series. On Thursday, September 9th at 7 p.m., we will reconvene to have a virtual discussion with local community leaders and experts on how we can act and engage at the local level. More information will be shared with you at the end of this event and by email on how to register for this follow-up discussion. Dr. Jones is joined in conversation tonight by Kanitra Fokwa Kenye, Senior Program Officer at the Horizon Foundation. Ms. Kenye will moderate the Q&A portion of the evening. Please add your questions to the Q&A box on your Zoom toolbar as you think of them. And now, Dr. Jones, I will turn it over to you to begin our conversation tonight.
Thank you. Thank you, Ms. Lawson. And I'm delighted to be here. And I'm delighted that you're here with me on this lovely summer evening. So I do want to spark a conversation, basically, a conversation on achieving health equity with a special focus on tools for naming racism and then moving to action. When I was president of the American Public Health Association 5 years ago, I launched our association on a national campaign against racism, not just our association, but as many other communities and partner organizations and our state affiliates and the like as would join us. This national campaign against racism 5 years ago needs to be sustained, and more people are recognizing that in this past year and a half. There are 3 tasks that I set as moving us forward. The first is to name racism, to say the whole word. The second is to ask, how is racism operating here? To identify levers for intervention, targets for action. And then the third is to organize and strategize to act. So the tools that I'm going to share with you tonight are actually communication tools, story tools. And these tools are going to illustrate 4 key messages when we're talking about racism. The first is that racism exists. The second is that racism is a system. The third is that racism saps the strength of the whole society. And the fourth key message is that we can act to dismantle racism. So the rest of this evening is going to be basically some of my stories, my allegories. I'm going to share with you my dual reality restaurant saga to bring home the point that racism exists. My newest allegory that I bet none of you have ever seen or heard, Cement Dust in Our Lungs, to talk about understanding that racism is a system and that we need to address racism as a system. My oldest allegory, which some of you may be familiar with, Levels of Racism, a Gartner's Tale, which will help us understand that racism saps the strength of the whole society. And finally, Life on a Conveyor Belt, Moving to Action, which will help us understand that each of us has a role and that we can act to dismantle racism. So let's start with the first story. Dual reality, a restaurant saga, like most of the allegories that I share in my teaching on issues of race and racism, was actually sparked by something that happened to me in my own real life, something that I saw with my own real eyes. So I'm going to jump into my life and I want to bring you with me. Remember that the moral of this story is that racism exists. So as a first-year medical student, I, of course, was very studious, very diligent. So on this Saturday, like on most Saturdays, I had awakened early and hit the books, nose in, studying hard. And by mid-afternoon, some friends came over. And did they distract me from my studies? Oh, no. We all got to studying long and hard, and now it's getting late and we're getting hungry, and I have no food in the apartment, which was so typical of me that my friends understood. They were like, never mind, Camara, okay, we got that, but we're hungry. We need to go into town and find something to eat. So we do. We go into town and we find a restaurant and we walk in and we sit down and the menus are presented and we order our food and the food is served and here we are eating. So maybe not the story you thought I was setting up about racism in a restaurant, but hold on. As I sat there eating with my friends, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now maybe I've intrigued you and you're wondering, Dr. Jones, what did the sign say? Oh, okay. Well, what did the sign say? The sign said open. So now maybe I've lost some of you because how is that a startling revelation about racism? But let me just recap where we are. Here I am sitting with my friends eating. I look across the room. I see a sign that says open. Thinking no more about it, I would assume other hungry people could also walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I actually recognized that now indeed the restaurant was closed due to the hour, but firmly closed. And that other hungry people, just a few feet away from me, but on the other side of that sign, would not be able to come in, sit down, order their food and eat. And that's when I recognized that racism structures open, closed signs in our society. That racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on because it's difficult for any of us to recognize a system of inequity that privileges us. So for example, it is difficult for men to recognize male privilege and sexism. It is difficult for white Americans to recognize white privilege and racism. In fact, it's difficult for all Americans to recognize our American privilege in the global context, although we are living that right now with how much of the global vaccine supply against COVID we have kind of sequestered in this country. Now, those on the outside are very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. It doesn't compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is an if, but if you do, well, you could even talk to the restaurant owner who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door, let them come in? You'll make more money. And oh, the conversations we could have. Or maybe what you'll do is pass some food through the window, or maybe you'll try to tear down that sign or break through the door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign that proclaims open to you. So when I have just 5 minutes or so to convey to a group of people, many of whom may have spent their whole life thinking that this is the land of equal opportunity, that I use this image to help them understand that yes, racism does exist in this country. It's structuring two-sided or multi-sided signs, creating a dual or multifaceted reality. And actually, I started a 3-hour conversation in Flint, Michigan one day, years ago now, but by asking this following question: how could people who are born inside the restaurant know something about the two-sided nature of that sign? And it was a 3-hour conversation because there are many, many ways to know. I do have to admit that I am heartened that there are more people who were born inside the restaurant who now have a sense that there's something two-sided going on about the sign because of the recent events in the past, especially past year and a half. There are more people who were born inside the restaurant who just 1.5 years ago might have been saying, what are those people outside saying? Black lives matter? Don't they know all lives matter? Who are now actually affirming Black lives matter. There are more people who were born inside the restaurant who are saying the word racism, putting together the phrases structural racism or systemic racism. This is very important. It's very heartening because you have to name a problem first before you can start addressing the problem, right? But this is my warning. If we just name a problem, if we just say the word racism, put something on our Facebook or tweet something out or Instagram or on our organizational web pages, that racism exists or we stand this and that and the other. If we just name racism, 6 months from now, we may forget why we said that thing and fall back into what I describe as the sleepiness or somnolence of racism denial, because racism denial is so staunchly held and so seductive in our society. So we have to go beyond naming racism to move to action. We need to tear down the sign. And of course, racism is not just a sign. It's a sign, it's a door, it's a lock. There's a whole system going on. So we need to dismantle the lock, take the door off the hinges, because once we start acting, we will not forget why we are acting. So that's my first story. I actually hope that you will remember at least one of the 4 stories that I will share with you tonight well enough that you can share it with somebody in your family or somebody in your neighborhood or somebody at work. You know, I really want you to share it. If you have some questions or thoughts or extensions or challenges, whatever in this story, this would be the time while you're remembering them to put them in the Q&A box, because I am going to move on. The first thing I'm going to do before I jump into the second story is to give you a definition of racism, because now I've said the word, who knows, maybe 10 times. So I want to be clear that when I say the word racism, I am clear that I'm talking about a system. So I'm not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested. I am instead talking about a system of power. Racism can manifest in all those ways, but in its essence, it's a system of power. And a system of doing what? Well, a system of doing 2 things: of structuring opportunity and assigning value. And on what basis is the opportunity structured, and on what basis is the value assigned? It's based on the social interpretation of how one looks, which is what we call race in this country. And I could give you an hour lecture on what race is and what race isn't and all, but I'm trying to be very parsimonious with how deeply I talk into my slides, because I do want to share all 4 stories before we open it up for your Q&A. So we'll just leave it here. But so we have race as the social interpretation of how one looks, racism as the system that operates on that so-called race to structure opportunity and assign value. So now, what are the impacts of this system? Well, when we do recognize that racism exists, we do usually recognize that racism is unfairly disadvantaging some individuals and communities. But it shouldn't take us long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly advantaging other individuals and communities. And that's the whole issue of unearned white privilege that we hardly ever talk about in this country because it makes some people, especially some people who are living as white, uncomfortable. In fact, years ago when I would share this definition and I'd be in a room of people and then I'd see people kind of do a little something like that and I'd be like, I would almost apologize. I would say, I know that talking about unfair advantage, unearned white privilege can make some people uncomfortable. If you feel uncomfortable, I would say, shake it off, stay with me. I'm going to tell you more stories. I don't apologize anymore. What I say now is if you feel uncomfortable trying to understand white privilege, I want you to lean into that discomfort because I have come to recognize that for all of us, the edge of our comfort is actually our growing edge. But there's a third impact of racism that many of us miss, and that is that racism saps the strength of the whole society through the waste of human resources. Again, I could give you many examples of that. I'm just going to quickly give you two. When we don't vigorously invest in the full, excellent public education of all of our children, because the blinders of racism have made some decision makers think there's no genius in the barrios or the ghettos or on the reservations. We can get along very well, thank you, without those kids. Or even right now, when we don't recognize the disproportionate impact of COVID on education in different communities, and when we're not actively trying to provide resources according to need to bridge that gap, right? Then we are actually, of course, because there's genius in all of our communities, we are wasting that genius. If we were to fully invest in all of the genius in all of our communities, we could be doing so much better as a nation or even as a world, right? Another just quick example of how racism saps the strength of the whole society is how it has made so many of us complacent with what I describe as the wholesale warehousing disproportionately of so many Black and brown men and women in our prison system, as if that didn't separate us from human potential. So of these three impacts of racism, the unfair disadvantage, the reciprocal unfair advantage, and how it saps the strength of the whole society, I actually think that that third bullet is where we need to spend a lot of our communication energy right now. I think we need more media stories talking about how racism saps the strength of the whole society. We need more data collection. We need more conversations around our dinner tables about how racism saps the strength of the whole society so that we have more people filled with a sense of urgency to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. Just one more thing I'm going to say. I'm trying not to talk deeply into each of these slides, but one more thing I want to say. Through an experience I had at the Centers for Disease Control and Prevention, I was there 14 years, through an experience where I was at one point told that of the three impacts I talk about, the unfair disadvantage, reciprocal unfair advantage, saps the strength, that I needed to take that bullet about unfair advantage off of my slide. And through that tossing and turning, and the compromise at the time until I left CDC was, well, if I took the words unfairly off of disadvantage and advantage, then I could talk about the two. But that taught me not just about that particular individual who was, had some say over what I did and didn't do. It taught me about a lot of people in this country, because I think that there are a lot of people in this country who say, yes, there are two states of being, but they describe those two states of being as disadvantaged and normal. And the reason that many people think that there are two states of being, disadvantaged and normal, is that we in this nation are ahistorical, and people do not understand that their so-called normal is built up on a whole mountain of unfair advantage. I would love to talk about that more if somebody wants to ask a question about that. But now I'm going to shift gears. I am a physician, a family physician. I am a PhD epidemiologist. So my work is focused on health. Everything I've been saying, of course, applies to health and housing and education and immigration and environment and everything. Racism has its impacts on all aspects of our lives. But as a health person, I was really interested, how could racism, as I defined it just now, turn into differences in the numbers of our babies dying before their first birthday, which is the infant mortality rate, or the numbers of mothers dying with pregnancy-related complications. That's the maternal mortality rate, where Black and Indigenous women, depending on what part of the country you're in, die 3 to 8 times as frequently as white women from pregnancy-related outcomes. How could COVID turn into differential numbers of people dying from COVID-19 by race? So I described 3 levels of racism: institutionalized or structural, personally mediated, which some people call interpersonal, but because I know that racism is a system, I prefer to describe this level as personally mediated, the system mediated through people, and internalized. So I am going to just briefly define each of these levels, give you examples of how they can impact health and other things, and then I'm going to illustrate those 3 levels with my next story, my Gartner's tale. So institutionalized or structural racism is the system, if you will. It's the constellation of structures, policies, practices, norms, and values, which taken together result in differential access to the goods, services, and opportunities of society by race. This is the kind of racism that does not require an identifiable perpetrator, because it's been institutionalized in our background, customs and laws and norms and policies and the like. This is the kind of racism that shows up as inherited disadvantage or its reciprocal inherited advantage. This kind of racism shows up both in material conditions as well as in access to power. So examples include differential access by race to quality housing, or excellent educational opportunities, or equal employment opportunities, or even the same level of income at the same level of employment. And clearly those things can impact health. Differential access to medical facilities, which could be physical access, it could be, financial access, even linguistic access. Differential access to a clean environment. So the very well documented disproportionate placement of toxic dump sites or bus transfer stations in communities of color, what many people have documented as environmental racism, arise there. What happened in Flint, Michigan, which I still, as far as I know, somebody told me they thought finally all of the water pipes, that the lead contaminated water pipes were out, but I don't know. I knew that for at least 4 years, they were not out. And then in terms of material conditions, access to power, in terms of access to power, so power as information about health stuff, information about where to get a vaccine, as well as information about our own histories. Power as resources, not just material resources, but social networking resources, knowing somebody on the board, and power as voice in media, in government, and the like. There are many assaults on power right now, on history and knowing our full history, on voting rights and the like. So, you can see how important understanding this level of racism is. Now, many times when I have been sharing this slide, people have asked, Dr. Jones, hold up. Would you please take a careful look at that top set of examples you have there: housing, education, employment, income. Dr. Jones, isn't that what we call social class? So why do you have it on a slide about racism? Dr. Jones, are you talking about racism, or are you really, really, really talking about social class? This is a very important question, which I'm sure many of you listening to me right now might be holding in your heart. So let me answer it. And the first part of the answer is that it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. That's not just a happenstance. And for each marginalized or stigmatized or oppressed group of color, there's been some initial historical injustice. So for example, for American Indians, for our indigenous North Americans, the initial historical injustice was the taking of the land and the near genocide. And then for the survivors, moving the survivors to reserved lands, to reservations. And then sometimes if something good was found under one reservation, oops, you got to pick the people up and move them someplace else. We had families who for centuries lived in Mexico, never crossed the border, but the border crossed them. They find themselves in New Mexico, Texas, Arizona, California. And the great-great-grandchildren still of these people who, where the border crossed them, are being harassed and vilified and targeted with the El Paso massacre. We had Chinese people encouraged to come over here to build our railroads, but then with the Chinese Exclusion Act, unable by law to bring their families, unable by law to marry here. We had the internment of Japanese Americans during World War II when the Italian Americans or German Americans were not interned. And for people of African descent, the initial historical injustice was the kidnapping of West African people, our importation across the Atlantic with tremendous loss of life in the Middle Passage, and then for the survivors and their progeny for generations and generations, what I describe as the coerced usury of our unpaid labor for centuries to build this country. But then people hear me talking like that and, oh, Dr. Jones, there you go talking about slavery. Dr. Jones, we all know that slavery was an unfortunate chapter in our nation's history, but Dr. Jones, the enslaved people were finally emancipated by 1865. In fact, we just recognized Juneteenth, which was Juneteenth 19th, 1865, which was the time when the enslaved people in Texas were finally aware of the Emancipation Proclamation, which had actually freed them in 1863. But anyway, so people say, well, Dr. Jones, the enslaved people, they were emancipated by 1865, and we are now in 2021, which makes that 156 years ago. So Dr. Jones, all else being equal, don't you think the impacts of slavery would have washed out by now? But of course, the answer is in the question and the key phrase, all else being equal, because all else has not been equal since 1865, and all else still is not equal today. And there are what I describe as present day contemporary structural factors that are perpetuating that and all of these other initial historical injustices that I had talked about. And these contemporary structural factors are part and parcel of institutionalized or structural racism. So when you ask me, am I talking about racism or am I really talking about social class? My answer is that structural racism explains why we even see an association between social class and race in this country. It doesn't just so happen. And this is a very important aha. Now I want to stay a little bit longer in this slide because this is the most important thing. If you don't understand anything else from anything else I say tonight, this understanding structural racism, I think is the most important. So I also need to say that some people ask me, well, Dr. Jones, you're so much on racism, you don't care about poor white people, do you? And that is not the case. I care deeply about poor white people, poor Black people, poor Indigenous people, poor Latinx, Hispanic people, poor Asian people, poor Native Hawaiian, other Pacific Islander people, poor all kind of people. And in fact, this is not an anti-poverty or an anti-racism kind of race, or issue here. If you gave me a magic wand today, and we need to be working on them, and in fact, the child tax credit is a little start of a magic wand today that I could use to eliminate poverty in this country, I would do it. Now, the child tax credit is being described as eliminating 1/2 of child poverty, 1/3 of poverty overall. Well, I think that's great. We need to go the whole distance. So if I could eliminate poverty, and I'm working on that, I would. In fact, if I could do a double ding with my magic wand and not only eliminate poverty, but equalize income, I would go all the way there. Yes, I would. But here's the trick to that. Even if I were to equalize income across all groups in this country today, if I did that without addressing the background structures, policies, practices, norms, and values, the mechanisms of structural racism, then in one generation, we would start to see a stratification by race in terms of income again. So this is not an either or anti-poverty or anti-racism, it is a both and. And the last thing I want to say about structural racism is that it can occur through acts of doing, acts of commission, as well as acts of not doing, acts of omission. And very often structural racism shows up, especially these days, as lack of action, inaction in the face of need. So I'm going to breeze through the other two levels of racism. Personally mediated racism, I define as differential assumptions about the abilities, motives, and intents of others by race. and then differential actions based on those assumptions. This is what most people think of when they hear the word racism. Somebody did something to somebody. It includes the different idea, the prejudice, and the different action, the discrimination. And it shows up in many, many ways. Police brutality is clearly one important way. Physician disrespect, physician not giving, it can be, physician disrespect can be subtle, like a physician not giving a patient the full range of treatment options because the physician figures, well, that patient wouldn't understand, wouldn't comply, couldn't afford, or whatever they assume. Or it could be quite blatant, like sterilization abuse, which has had many iterations in our nation's history. Shopkeeper vigilance, being followed around in stores, or waiter indifference, not getting quick, respectful treatment, which are just two examples of what some people describe as everyday racism. The microaggressions, the subtle communication of disrespect, which may be related to elevated blood pressures in communities of color, blood pressures that don't even go down at night. And then teacher devaluation, very important manifestation of this level of racism, because if a teacher looks at a young child, and thinks that child can't learn, and puts that child off in the attention deficit disorder track, that child may never even know their full potential, much less have the opportunity to develop to their full potential. Now, personally mediated racism, like institutionalized or structural, can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission. But even more important is to understand that this level of racism can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. The third level of racism, internalized racism, I'm defining on this slide from the point of view of members of stigmatized races as acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. Now, I have been asked by some of my compatriots who also do anti-racism thinking and working and action and training, what about, they say, Camara, what about the internalized sense of entitlement that many white people walk around with? Isn't that also internalized racism? And I agree, it is. But I haven't figured out how an internalized sense of entitlement can turn into bad health outcomes. Although an internalized sense of entitlement thwarted may be at the base of some of the diseases of despair that have been described, the diseases of despair in white populations, including suicides and the opioid overdoses and the like. But the rest of this slide is still from the point of view of members of stigmatized races, where internalized racism shows up as self-devaluation, feeling maybe I really am less than. Maybe I really shouldn't try to graduate from high school or apply to that college or try to get that job or live in that neighborhood. It turns into the white man's ice is colder syndrome. I heard that phraseology from my parents and their generation. What it meant then and what it still means for many people of color today is what, take me as an example. Say I'm Black. If I need a lawyer, I might actually seek out a white lawyer over a Black lawyer. Or if I were sick, I might prefer the white doctor over the Black doctor if I could find a Black doctor. Or if my lemonade were warm, I might go way down the street to get the white man's ice over the Black man's ice, deeply believing that the white man's ice is colder, deeply internalizing the myth of white superiority. Internalized racism shows up as resignation, helplessness, hopelessness, which turns into a lot of self-destructive health behaviors. And in its essence, it's acceptance by members of stigmatized races of the limitations to our own full humanity of the box into which we've been placed. So that when you hear young high school students of color, and one of them's trying to be the high school valedictorian and the others are teasing her or him, saying, well, so-and-so is just trying to be white, we need to challenge that. Because since when did white people claim exclusive access to excellence? They did not. So now I'm going to illustrate these three levels of racism and what we need to do about them with my Gartner's tail allegory. And I'm going to stop sharing my slides briefly because I'm going to use my hands even more to tell this story. So this was also based on something that I saw with my own real eyes. So let me tell you my own real story, and then we're going to make it a story about racism. So my husband and I had been married about a year when we were moving down to Baltimore so I could finish my PhD at Hopkins. And we bought our first freestanding house, cute little house with a big wraparound porch with flower boxes dotted all on the porch. And we bought the house in October, which in Baltimore really wasn't the time to plant. So we waited. But when spring came, my husband, who loves to garden, ran out on our porch, gonna decorate our cute little house with our marigold seed. But then he came right back in and he said, Camara, some of these boxes have some dirt in them already, but some of these boxes are empty. I need to go down to the gardening store. So he does. He goes to the gardening store and he comes back hauling big old bags of potting soil. And then we fill up the empty boxes with the potting soil. And then we sprinkle equal numbers of our marigold seeds in all of the boxes, and we water all of the boxes equally. And now, because I am not the gardener in the family, by now I am exhausted. So I figure I'm just going to sit back and be delighted. Well, about 3 weeks later, I'm walking out of my front door onto the porch, and I finally pay attention to these flower boxes. And what I saw made me literally stop in my tracks, because what I saw made me think we have planted completely different species in some boxes versus others, because some of the boxes were full of plants and the plants were tall and vigorous looking. And some of the boxes just had a few plants in them and they were kind of scrawny and scraggly looking. And then I realized what had happened. That potting soil that my husband had bought turned out to be rich, fertile soil, so that every single seed planted in that rich, fertile soil had sprouted. The strong seed had grown very tall and vigorous, but even the weak seed had made it halfway up. But that old soil that we found there turned out to be poor, rocky soil. So the weak seed planted in the poor, rocky soil just died. And even the strong seed in the poor, rocky soil had to struggle just to make it to a middling height. And some of you guys might be nodding just about now, because maybe you're gardeners and maybe you've composted half of your garden. So maybe you've seen this image with your own real eyes. And the image, of course, is about the importance of the soil, the importance of the environment. But now we're going to take this image and we're going to make it a story about racism by introducing a gardener. So now we have a gardener who has two flower boxes, one which she knows to have rich, fertile soil, one which she knows to have poor, rocky soil, and she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms, and some of the seed is going to produce red blossoms. And the gardener prefers red over pink. So what does she do? She takes the red seed, puts it in the rich, fertile soil, pink seed in the poor, rocky soil, and 3 weeks later, she sees in her boxes what I saw in mine. In that rich, fertile soil, all the red seed sprouts. Strong red seed grows tall and vigorous. Weak red seed makes it halfway up. In that poor, rocky soil, weak pink seed dies. Here comes a strong pink seed, just struggling to make it to a middling height. And then in those two flower boxes, those flowers go to seed. And then the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year, the same thing happens until finally, about 10 years later, the gardener's looking at her flower boxes and she says, I was right to prefer red over pink. So we're going to interrupt the story for a moment to say the first part of this story is how institutionalized or structural racism works, where you have the initial historical injustice of the separation of the seed into the two types of soil, the contemporary structural factors of the flower boxes keeping the soil separate, and then through inaction in the face of need, perpetuation of the inequity. But let's pick the story back up and say, well, where is personally mediated racism in this garden? Well, the gardener's looking over at the red flowers thinking, oh, red is so beautiful. And then she looks at the pink flowers and she says, oh, those pink flowers sure are scrawny and scraggly. So she plucks them off before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil. So she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them not acknowledging or perhaps not even understanding that they're benefiting from enriched soil. The pink flowers are looking over at red, thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees, minding their own business, collecting nectar and pollinating at the same time. So here comes a bee into one of the pink flowers and to another pink flower and to this pink flower. And this flower's like, get away from me, bee, don't bring me any of that pink pollen. I prefer the red because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, we could start by addressing the internalized racism. So we can go over to the pink flowers and we can say, pink is beautiful, power to the pink. And that is an important intervention. But if that's all we do, it's not going to change the situation in which those pink flowers find themselves. So you can say, okay, well, I know, let's address the personally mediated racism. Let's have a conversation with the gardener, or better yet, let's have a workplace multicultural workshop for the gardener. So it's all good, we do. And in the workshop, we say, dear gardener, would you please stop plucking those pink flowers? And maybe she will, maybe she won't. But even if she does, it's still not going to change the situation in which those pink flowers find themselves. If we really want to set things right in the garden, we must address the structural racism, which means we have to either break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although it does make it easier for that original gardener to keep segregating resources going forward. But if you decide you're going to keep separate boxes, it means you need to enrich that poor rocky soil until it is as rich as the rich fertile soil. And when you do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. So that in that intervention on the structural racism, you'll also have addressed the internalized racism, because pink will no longer be looking over at red thinking red is better or wanting to be red, because they'll see how beautiful they are. And in that intervention on the structural racism, you may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful would be less likely to have that kind of attitude. So this story has been to illustrate those three levels of racism, to say that we need to at least address the structural racism, good to address all levels at the same time, but at least address the structural racism. And when we do, the other levels may take care of themselves. But there's one more question that I haven't raised yet, and that is, who is the gardener? After all, the gardener is the one that I gave the power to decide, the power to act, and control of resources, which are actually the elements of self-determination. Who is the gardener? Well, in the US context, the gardener certainly includes the government. That's a huge part of the gardener, but not the only part. You know, media, foundations, corporations, communities, to the extent that they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red. That's why she prefers red over pink. And it's dangerous when the gardener is not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. So this raises another question. What do we do about the gardener? Do we need to make the gardener striped or polka dotted or fuchsia? Do the pink flowers need to grow or recruit their own gardener? So many questions can come out of this story. And before I go into the third story, we're nearing the end. The other stories are not nearly as long. But before I go to the transition to the next story, I do want to share with you two frequently asked questions. The first was maybe 15, 20 years ago, but it was in the audience and it was like, Dr. Jones, Dr. Jones. I was like, yes, Dr. Jones, why should the red flowers share their soil? When I heard that question, I loved that question because it showed me the power of this story to start conversations about racism that might be otherwise difficult if we're talking about racism between you and me. My answer to that question, why should the red flowers share their soil, is that actually that soil doesn't belong to the red flowers. It belongs to the whole garden. Here's the second question. What if that's not the original gardener that we're looking at there? What if that's the gardener's great, 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 great grandchild? Here we are. And the great, 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 great grandchild has always seen the flowers looking like that, may not even think there's a problem to be solved. So very quickly in 3 steps, what we need to do, first of all, is make the differences in the height and vigor of the pink and red flowers a problem requiring urgent solution. We need to put it on our urgent action agenda. But then step 2 is, okay, but what are we going to do to act? And so the second step is we need to make those flower boxes transparent so we understand and can act on the differences in the quality of the soil. But then the third step is, as we make those flower boxes transparent, we need to make sure that everybody understands that the pink seed did not just go launch themselves into that poor rocky soil. So we need to talk about history, and we need to talk about how the gardener's initial preference for red over pink set up that whole situation. Some people call that kind of preference, cultural racism. In our US context, it's clearly white supremacist ideology. We must talk about that and address that, because if we do not, even if we were to compel that red gardener today to enrich the poor rocky soil today until it was as rich as the rich fertile soil today, if she continues to prefer red over pink, she will continue to privilege red over pink going forward. So, you know, when I defined racism as a system of doing two things, of structuring opportunity and assigning value, for many years when I told the Gartner's tale, it was just about the soil in the boxes. It was a very structural analysis until one day in the telling of it, I understood this second point. We need to address both the structural stuff and the values piece if we're going to set things right in this garden. So here is my third story, cement dust in our lungs. This is my newest allegory. I haven't even written it out yet. So every time I tell it, it's a little different, and maybe you'll have some suggestions for me. When I tell this story, I'm going to be talking about cement dust. I want you to think about cement dust, and I also want you to think about racism, okay? So imagine that there's a cement factory spewing cement dust, and the cement dust fills the air. And if you're anywhere around that factory for any amount of time, you're going to get cement dust in your lungs, each of us. And cement dust in our lungs is problematic. Now, it can affect us differently. You know, the cement dust in my lungs might make me feel like I'm less than, so it might be more the internalized cement dust. The cement dust in somebody else's lungs might make him feel that he can, with equanimity, crush the life out of another human being with his knee for 9 minutes and 29 seconds. So maybe the personally mediated. But for all of us, even for those who don't recognize they have cement dust in their lungs, this is problematic. The question is, how should we address this? Should we focus on the individual? Well, I'm going to give you an example of two ways that we can focus on the individual. And actually, the first way I don't recommend at all. But let's say we had some kind of screening machine and it would check people. And then if there was too much cement dust in your lungs, some kind of alarm would go off, and then there would have to be some kind of action. This is not a good idea. In fact, this is the reason people don't want to talk about racism, honestly, because they think if you say the word racism, you're really trying to divide the room up into who's racist and who's not, or peer deeply into their soul to say exactly how racist are you. So this is a bad idea, because what are we going to do anyway? What are we going to do with people, right? Well, maybe one of the things we can do with people is, at least if they want it, maybe we could set up a cleansing spa. So if you recognize you have cement dust in your lungs and that it's problematic, maybe you can choose to get a training or something. So you go into the little training, the cleansing spa, and then you do your thing, and then you come back out as good as new, but you come back out into that same cloud, and the cement dust eventually reaccumulates in your lungs. So a focus on the individual is insufficient. Well, what does that mean? Do we need to acknowledge the cloud? Well, I would say yes, at least. We need to acknowledge that the cement dust in my lungs, I wasn't born with that, right? And that it came from somewhere, that I am living in a cloud surrounded by racism. This is when we start naming racism, right? Some people would say, well, we start naming races, white supremacist culture. I've heard a lot of my friends who are living as white talk about that. But yeah, that thing that we're in this cloud surrounded by it. Well, if I recognize that and I don't want any more cement dust in my lungs, I might choose to put on a gas mask. That is to start my individual anti-racism journey. Now, I recognize that the gas mask is going to keep more, or hopefully most of more cement dust from getting in my lungs. It's not going to extract the dust that's already there, but it's a good thing. And also, it's good because when I see myself reflected in a glass or look at myself in the mirror, then I'm reminded by looking and seeing myself with this gas mask to be aware that there's racism everywhere. And when you all see me and you ask, Dr. Jones, why are you wearing a gas mask? I said, well, we're surrounded by racism. I name racism. And then more and more of you may decide to put on a gas mask. That is to start your individual anti-racism journeys. So that's good in the short term, but is that what we're really trying to do? Everybody has to put on a gas mask. We need to make a little baby gas mask and senior citizen gas mask. Well, I think instead of just focusing on the cloud, we need to dismantle the factory. So especially those of us who already recognize that we're living in this cloud, we need to move to action to ask, how is racism operating here? To try to understand the factory. In fact, it's hard to see this factory and all this dust. So those of us, who understand that there's a factory in the middle of this need to go there. And then we need to organize and strategize to act, to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. So you see, it's important for us not to just know that racism is a system, but our interventions need to be directed at racism as a system, as opposed to being individually or even culturally targeted. All is good, But if we're really going to set things right, we need to dismantle the factory. Now, in that story, I raised the question, how is racism operating here? In fact, when I first gave you my 3 tasks for a national campaign against racism, I said the first was to name racism. The second was to ask, how is racism operating here? And the third, to organize and strategize to act. And I'm going to say further that this question, how is racism operating here, is a legitimate question, because racism is not just a cloud, a miasma that we can't get a handle on. It is a system with identifiable and addressable mechanisms, which are in our structures, policies, practices, norms, and values, which turn out to be the elements of decision-making. Where structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, what's on the agenda and what's not. And I charge you henceforth, whenever you find yourself at a decision-making table or you set one, to have as your first job to look around and say, well, who is not here who has an interest in this proceeding? And then, although you might need to represent their interest in the short term, that's not what you're trying to do. What you're really trying to do is create space to find them a way to the table. And if structures are the who, what, when, and where of decision-making, policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, harder to get a handle on, and values are the why. And I think we need to take this question with us everywhere. How is racism operating in my child's daycare, on my job, in my community? How is racism operating in the Howard County library system, in my schools? How is it operating in the state of Maryland? How is it operating in the United States and in the world? And I find it useful. If you take that question and you just think for 10 or 15 minutes at the who, what, when, where, how, and why of decision-making, structures, policies, practices, norms, and values, you can identify 5, 10, 15 initial ideas, levers for intervention, targets for action. So now I said action, what can we do today? Going back to that image from the open close sign, from the dual reality, we need to actively look for evidence of two-sided signs. We can't be complacent. Oh, it looks open to me. We need to actively look and say, is there something differential going on here by race, by gender, by sexual orientation, by immigration status, by language, by zip code, by urban, rural, by religion, by all kinds of things, all the ways that we slice and dice our population. And we need to look not just for outcomes, but also for opportunities. We need to burst through our bubbles of experience to experience our common humanity. Each of us is in a bubble of experience. Some of the bubbles are quite big with thin soap bubble boundaries, you know, our communities, our kids in their schools and our jobs and all that. Some of our bubbles are smaller with thicker plexiglass boundaries. Some of our bubbles are tinted. Some of our bubbles are polarized, but whatever kind of a bubble experience we are living in, each of us, most of us do not know that just across town, there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We need to create individual and institutional bubble bursting opportunities so that we can experience our common humanity in different circumstances and then start to build common cause. We need to be interested in the stories of others, believe the stories of others without requiring cell phone documentation, video documentation, or body cam footage, and then join in the stories of others. And I'm encouraged that we have been doing that over this past year or so. We need to develop a sensitivity to see the absence of who is not at the table, what is not on the agenda, what policies are not in place that if put in place could bring us more social justice. And we need to reveal lack of action, inaction in the face of need, because that is how structural racism very often shows up these days. But all the power is not on the side of those inside the restaurant, because those on the outside, we need to know our power to recognize that action is power, and especially that collective action is power. But you're like, hold up, you only told us 3 stories. That's right, here's my 4th story to take us out about action, moving to action. And this one I call Life on a Conveyor Belt, Moving to Action. And this story was not sparked by something in my own real life. It was sparked by an image in the book, Why Are All the Black Kids Sitting Together in the Cafeteria? And Other Conversations About Race by Dr. Beverly Daniel Tatum. In her book, she's trying to explain, especially to white people who say, like, I'm not racist, that people participate in racism passively, that racism is like a people mover, like a conveyor belt, and you're just living your life on this conveyor belt, just raising your kids, going to school, going to work or whatever, but moving inexorably through and toward racism. I want to take Dr. Tatum's image of life on a conveyor belt and expand on that image to talk about how we can become actively anti-racism. So here we are. So I usually I did this when walking across the stage in the olden times, in the before days. But anyway, so here we are on this conveyor belt, moving inexorably. Well, actually, mostly it's white people on top of the conveyor belt, and people of color are sometimes being ground up, making the conveyor belt move. But, you know, so there's some of us on top of this conveyor belt, just living our daily lives, you know, focusing on our kids and our work, moving inexorably through racism and toward racism. And there's actually a big sign up there saying racism, 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 but we're so involved in our lives, we don't even see it. Maybe we might look up and go, oh, racism, and then we close our eyes. So we're in denial and we just keep on going. Or maybe we look up and we say, oh, racism, and then we turn around, but that's all we do. So we keep getting drawn on. Maybe we're colorblind. What do I suggest that we do, right? So here we are on the thing. Maybe today with these stories, you're like, oh, racism. Clearly, we do need to turn around, right? But then you can't just stay in that same place. You need to take a move. You need to start acting. You need to take a step and another step. And then you need to start walking at least as fast as the conveyor belt is moving just to stay in the same place, right? And now let me ask you this. What happens when you're walking backwards on a crowded conveyor belt? You start bumping into people and they're like, hey, buddy, watch out. What you doing? And this is your opportunity to do the first of the 3 stages of being actively anti-racism, which is to name racism. You say, well, do you see where we're going? Do you see that sign? Do you want to go there? Now, most people do not want to be disturbed out of their comfort. So they'll be like, just get out of my way. But maybe 1 or 2, you know, because you said, do you want to go there or will you turn and go with me? Maybe 1 or 2 will turn. So now you have 2 or 3 people walking backwards on this crowded conveyor belt, and you keep bumping into people and you keep naming racism and inviting them to turn with you. And more will turn, never 50%, but more and more. So now you're starting to get kind of a critical mass. And so you can do not just walk at the same pace. Now you can start moving this way, not just away from the sign racism, but what you're trying to get to is the motor that is making this conveyor belt work. So now here we are and we're at the motor. So now it's time for the second of the 3 tasks of being actively anti-racism, which is to ask the question, how is racism operating here? Looking at structures and policies and practices and norms and values. And I think it's this lever. So I'm gonna pull up on this lever and the whole system starts shaking, and I've done it, except racism is a very fancy system. So it reconfigures itself and it just keeps on going, which is the importance of the 3rd task of being actively anti-racism, which is to organize and strategize to act. So as I'm pulling up the lever, I need one of you to push a button. I need another one of you to swing that pendulum. I need another one of you to pull on that pulley, and all of us together, I do believe, can dismantle this system and put in its place a system in which all people can know and develop to their full potentials. It is especially urgent now more than ever, and we are alive now, and this is our time to act. So I invite you to name racism and move to action. And I share 4 stories with you. Here are the 4 key messages. Racism exists, racism is a system, racism saps the strength of the whole society, and we can act to dismantle racism. I hope you remember at least one of these stories. And now I look forward to the Q&A time with you.
Thank you so much, Dr. Jones, for that wonderful presentation. Good evening, everyone. I am Kenitra Fokwa, and I'm with the Horizon Foundation, where I serve as our Senior Program Officer. And I have the honor of moderating this question and answer session with Dr. Jones. So again, Dr. Jones, we just want to thank you for giving us that wonderful presentation, just full of visual stories to really get us to understand how racism is operating here. So I hope as we were listening to your presentation, we were thinking about, what that looks like within Howard County. So we know that we are a county full of resources with great schools and low crime rate and many opportunities, but we also know that there are many gaps that Dr. Jones talked about today. So I hope we keep that in mind as we are, going through this session, question and answer session. So we do have a couple of questions in the chat, and I do encourage everyone to continue to put your questions in the chat so we can pose them to Dr. Jones. But we do have one question around,
In the chat and the Q&A, right?
The chat and the Q&A, yes, thank you. We do have a question of what type of action can hospitals take in order to improve health equity among people of color?
I think, first of all, involving people of color from communities that may not be getting the access at the decision-making table. I have really come to the conclusion that who's at the table is the most important thing. So, instead of having satisfied patients as your community advisory panel or whatever, reach out into communities, to people and to community leaders, and find out how the hospital can be more responsive to people. Because what happens is that the triage happens before people get to the hospital. Certain people access certain hospitals that have more resources, and other people can only access other hospitals. Even in terms of how the ambulances take people, there's sometimes some racialized triage going on there. The other thing is, especially if it's a teaching hospital, often people based on income, and I know you're Howard County and all of that, but people are triaged to a teaching service versus a faculty service. Like, make that random or don't do that anymore. There's so many subtle ways that people are tracked into differential care opportunities. So I just say one more thing on that, because I know we're sort of like, I can answer a long time. I think that an inside-outside strategy, whatever institution you're talking about, if you're talking about hospitals, if you're talking about banks, if you're talking about schools, if you're talking about whatever, museums, an inside-outside strategy is always useful. What you're trying to do is you're trying to make your institutional walls as porous as possible. You're trying to invite, if you're inside trying to do progressive things, then you need the support sometimes of those people on the outside. They need to know what you're trying to do, right? Because sometimes people inside will try to stop you, and then they need to say, no, 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 we know what they're doing, and you can't do that to that person. On the other side, those people who are on the outside sometimes need the people on the inside to say, well, this is how you navigate this, or there are some grant opportunities that are going to be coming down the pike in a week or in a month or something like that. Why don't you consider applying for that? And so that kind of inside-outside strategy is good for change, no matter what sector you're in. And each of us will at some point be inside and at some point be outside. But if we're always aware that we need to keep those relationships strong, then I think that we'll be able to move to justice better.
Thank you. The next question we have is around our school system. How can schools work to support equity?
So I'm going to give you, so I didn't really give you my definition of health equity because I knew I was just going to do the stories thing. So let me give you that definition, and then we'll get there. So I have a 3-part definition of health equity, but it's educational equity, housing equity, it's all of those things. So I say that equity, health equity, is assurance of the conditions for optimal health for all people. It's a process. We could say educational equity is assurance of the conditions for optimal educational outcomes for all people. Or we could say social equity is assurance of the conditions for optimal health and well-being for all people. It's not an outcome. In health, we said the Healthy People 2020 definition of health equity, to which I contributed, started out health equity is attainment of the highest level of health for all people. Clearly, that's our goal. But I don't think it's a useful definition of health equity, because what if we hit that last Sunday? Are we done? Right? And I don't think health equity is an outcome. It's a process. Which process? Assurance, which is a governmental function and community function and all of that. It's actually one of the 3 core functions of public health that were identified by the Institute of Medicine. Assurance, along with assessment and policy development. Assurance of what? Of the conditions for optimal health for whom? For all people. That's what makes it equity. But that's just the second part of my definition, is how do we get there? And achieving health equity requires at least these 3 things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. And how is health equity related to health disparities? Health disparities will be eliminated when health equity is achieved. Health disparities are differences in outcomes. the differences in the height and vigor of the pink and red flowers. Health equity is all that opportunity structure that came before. So the quality of the soil, the water, the light, all of that. So how can we do this in our schools? We need to value all of our kids equally. We need to believe in the genius in all of our kids. And I think that it's not useful to track kids, so we should be avoiding tracking. We need to have strong investment. We need to make sure that all of our schools have teachers with equal experience. And we don't teach for America is all fine, but if you have teachers just cycling in and out, practicing and learning in certain schools, that's not a good idea. So we actually, educationally in our teacher training should have a kind of apprenticeship the way they do in Finland. I think that 2 or 3 year apprenticeship after people finish their education training to become good teachers and the like. So what we need to do is find out those schools that have the best outcomes. What are they doing with their kids, and then support and then provide resources according to need, not just the same as, but provide whatever extra resources are needed, because we need to, that's the key of equity. I know I talk long, so I'm sorry. I'm gonna be one sentence on each of these next questions, one sentence.
Not a problem. I'm sure everyone is enjoying it. In your previous response, you talked a little bit about outcomes and, the ultimate goal. And just a follow up to that is, how are you measuring success, or like, how do we know when we're talking about, dismantling the system of racism? How do we know that we're making progress, or how do we know that we're moving the needle or going in that right direction?
I'm going to be two things, but I'm going to try to be short. The quick answer is when the phrase disadvantaged child will have no meaning. When we can't even imagine a child being born into disadvantage or finding themselves falling into disadvantage. So that is the ultimate thing. So we will know we have made it when there's no such thing as disadvantaged child. But the way to get there, so often we are constrained, politicians, researchers, funding agencies, so foundations always have like a 3 to 5 year investment idea, because people want to get credit for their investments, sort of, or they want to make sure it's working. What we need to do is recognize that the investments we need to be making are investments in opportunity structures. And then we can measure changes in opportunity structures, but we will not see fully manifest the changes in outcomes for a generation, 20 years or 25 years. In other words, if you think back to my gardener's tale, if you have a pink flower who's sort of made it halfway up in the poor rocky soil, and then you're going to enrich that poor rocky soil until it's as rich as the rich fertile soil, that flower that's already planted might grow up another 1/4 inch. But it's not until that flower goes to seed and the seed falls into the rich fertile soil that we will really see the impact of our investment. So we as people, as institutions, need to be willing to invest in opportunities and in opportunity structures and patiently await the differences in outcomes in a generation. Another way I say it is we need to be willing to plant an acorn today so that our grandchildren can have shade.
Yeah, thank you. So we have another question which relates to some of your definitions and how you define some of your work. So in terms of critical race theory, they would like to know, what do you think of this, and where would you put that in your systemic racism outline and definition?
So critical race theory is a legal theory. It was developed by lawyers who were responding to critical legal studies, where critical legal studies was another whole thing. And they felt that the critical legal studies was not taking into account race or racism at all. And so critical race theory basically, I'm not a student of critical race theory. So, I know of, and I started to read some of the papers, but so I'm going to tell you what my understanding of critical race theory is that basically it's saying that racism is structural in our society, that it's embedded in our society. And I clearly believe that. I think racism is foundational in our nation's history, and yet many people are in staunch denial of its continued existence, right? And they're in staunch denial of its very negative impacts on the health and well-being of our nation and the world. So in that, I agree that racism is structural. But critical race theory is nothing that's taught anywhere except in law school. And now maybe some of the collections of essays, in some advanced college courses, it might be taught. When people who are anti-critical race theory are attacking things, they don't know what critical race theory is. They probably have never read a paper on critical race theory. What they are trying to attack, though, is recognizing that racism exists. My 4 messages. They're attacking racism exists. Racism is a system. Racism saps the strength of the whole society, and we can act to dismantle racism. So they don't want us to be about anti-racism. They don't want us to say the word racism. They don't want us to know our histories. You know, they don't want us to talk about the values piece. When I talked about the Gartner's tale and the initial preference for red over pink and the continued preference for red over pink that's manifesting. And so white supremacist ideology, they don't want that conversation at all because they feel that it's going to make them uncomfortable and their children uncomfortable. If they really understood critical race theory is not blaming individual children or adults or anything at all. It's about systems. It's about the cement dust in the lungs, and that we have to focus on the system. Thank you for making me understand that point. Now I'm going to add that to my cement dust thing, that really, that it's not about the individual at all, but until we address the system, then we're still going to have cement dust in our lungs. All of us.
And I think we might have time for just one more question. And this one relates to your Gartner's story. And you talked about the fact that good soil belonged to all the flowers and not just to the red flowers. But how to respond to those red flowers who are convinced that they have earned that soil or they own that soil?
Well, they need to read their history. This is what anybody who wants to understand anything needs to read history. So they just need to, you know, I mean, honestly, when people are at the edge of their comfort and they're trying to stick a toe into understanding something about racism, I mean, there's some good books out there like how to become an anti-racist or white fragility and all, but I don't recommend those. I recommend reading history. In this country, I have to say there are 7 barriers to our achieving health equity that are baked into the culture of this country. The first is that we're very narrowly focused on the individual, and that makes systems and structures either invisible or seemingly irrelevant. So people can't even imagine that there's a system or structure going on. The second is that we're ahistorical. We act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. The third is our endorsement of the myth of meritocracy, that if you work hard, you will make it. Now, I give you that most people who have made it have worked hard. Not everybody who's made it has worked hard, but most people who have made it have worked hard, but there are many, many, many other people working just as hard or harder who will never make it because of an uneven playing field, which has been structured and is being perpetuated by racism, sexism, heterosexism. All of these systems of structured inequity. The fourth is the myth of a zero-sum game, that if you gain, I lose, which sets us up in competition with one another, as opposed to cooperation. It masks the cost of inequity that is sapping the strength of the whole society. The fifth is our limited future orientation. We in this country don't pay attention. We have a disregard for the children and a usurious relationship with the planet. The sixth is our myth of American exceptionalism. And the seventh is white supremacist ideology, which is not a lightning rod term. It is the false idea of a hierarchy of human valuation by race, the falser notion that even if there were such a hierarchy, which is not, that would put white people at the top as the ideal or the norm, but it gives many people who are living as white a sense of entitlement. It results in the dehumanization of people of color and fear at the browning of America that's underlying our political divide today. So what would I say to people who say that that is their soil? They need to read history. They need to understand. They need to read books like The Color of Law by Richard Rothstein, or The New Jim Crow by Michelle Alexander, and on and on. I know we're running out of time, but read history. Then you will understand, and then burst through some bubbles. Go across town and meet somebody and stay a while. Go across town and stay a while and understand that people across town who are just as kind, funny, generous, hardworking, smart as you are, who are living in very different circumstances, not because they chose to, but because this is how things were structured for them. And then understand that things were also structured for you.
Thank you so much, Dr. Jones. You have given us so much to think about and so much to act upon. So on behalf of the Horizon Foundation and the library, we truly do thank you for your time today. And I would be remiss if I did not say to our participants on this call today that the Horizon Foundation invites you to check out our website and join our newsletter to stay up to date on our current activities around what we're doing within the equity space and future opportunities to get involved. I will now pass it back over to Christy at the library to close us out. Thank you so much.
Thank you so much, Dr. Jones and Ms. Kenye, for that incredible and engaging presentation and conversation. I really do think we could keep talking for hours because there's just so much to cover here. So tonight was the first event of our Racial Equity and Local Action series. We hope it has inspired you to learn more and maybe even connect to organizations pursuing racial equity and health to get involved. We have a follow-up event on Thursday, September 9th to help you do just that. So you will receive more information about health disparities by race in Howard County and hear presentations and have conversations with local leaders and organizations working for health equity. So we hope you join us for that dynamic event that will connect you with opportunities to make a difference. There's a link to register in the chat. Thank you to all of you at home who logged in for this event. And thank you again to the Horizon Foundation for sponsoring this event. And on behalf of the library, we appreciate you taking the time to join us and to learn. Tomorrow, you'll get an email from us with all the links shared in the chat, as well as the survey. We really value your feedback and thank you in advance for completing that. Take care, everyone, and have a lovely evening. Keep an eye out for that email tomorrow. Good night.